You wake up and your legs feel like they're made of concrete. They're swollen, stiff, heavy. You assume it's just poor circulation or the beginning of something you'll need to accept. But here's what many people miss. The problem may not be your blood vessels at all. It may be that an essential pump inside your calf muscles has been switched off for the past 8 hours. And once you understand how this pump works, you can often restart it. Your legs are not just carrying weight. They are working against gravity constantly. And there is one muscular system that most people never think about, even though it is responsible for pushing fluid and blood back up to your heart every single time you move. When that system stops working efficiently, fluid pools in your legs overnight. Your calves swell. You feel heavy and stiff. The good news is that understanding this mechanism gives you concrete actions that actually work. In this video, we will look at how the calf muscle pump actually works, why it shuts down during sleep, what distinguishes concerning patterns from normal aging, and the practical steps you can take starting this morning to improve how your legs feel. The central pump that most people never learned about. Let's start with the basic mechanism. Your heart pumps blood downward and outward to your entire body, including your legs. But your heart cannot pull blood back up against gravity. That is where your calf muscles come in. The medical term is the soleus push-up reflex, but we can call it the calf pump. Your calf is not just there for walking or climbing stairs. Its primary job, performed hundreds of times a day when you move, is to squeeze the blood vessels within it and push blood back up toward your heart. Picture it like a hand squeezing a sponge. When your calf muscle contracts, the blood vessels inside it get compressed. That compression pushes fluid upward. The moment the muscle relaxes, the valve system in your veins prevents that fluid from falling back down. So with each step, each small movement, your calf is actively pumping against gravity. Now here is the problem. Every night you stop moving. You lie down for 6 to 10 hours. Your calf muscles do not contract. They do not squeeze. That pump shuts off completely. And when the pump stops, gravity wins. Fluid that should have been pushed back up toward your heart instead pools in your legs, your feet, your ankles. You wake up feeling that heaviness. You feel that stiffness. Your shoes might feel tight. Your legs might feel like they have been sitting in water all night. This is not a circulation failure. Your arteries are probably fine. Your veins are probably fine. But the mechanism that moves fluid against gravity has simply stopped working. You might assume that overnight swelling is harmless, a minor annoyance of aging. But it is worth understanding because the pattern tells you something important about what is happening inside your body while you sleep. And some patterns of morning heaviness do deserve more attention than others. When that pump stops working, several things happen. First, fluid moves out of your blood vessels and into the tissue around them, causing swelling. Second, that stagnant fluid becomes thicker and harder to move. Third, if this continues night after night, the tissue itself can become less elastic, and the problem can become harder to reverse. Fourth, the longer fluid sits in your legs, the more nutrients cannot reach those tissues efficiently. You feel heavy, stiff, and sometimes even uncomfortable when you first try to move. Now comes the key distinction. For most people, morning heaviness that improves within 30 to 60 minutes of movement is a mechanical problem, not a disease. It is your calf pump simply waking back up. But morning heaviness that does not improve with movement, or heaviness that is only on one side, or heaviness that comes with skin changes or warmth, may signal something that deserves evaluation by a professional. The first overlooked cause, inactivity during sleep. Let's separate what actually matters. The biggest reason your legs feel heavy in the morning is simple. You have not moved in 8 to 10 hours. Your calf pump has been off. Gravity has won. This is mechanical, not medical. It explains why the heaviness is usually worse after longer sleep and why it improves quickly once you start walking. Picture what happens during sleep. You are lying still. Your calf muscles are in their most relaxed state. The veins and lymphatic vessels in your leg, the ones that depend on muscle contraction to push fluid upward, are receiving no help. Fluid accumulates. The pressure builds. By morning, your legs feel the weight of that pooled fluid. Here is what to do. Move immediately upon waking. Walk to the bathroom. Do a few calf raises while standing at the sink. Walk down the hallway. Do not lie in bed scrolling through your phone. That delay allows more fluid to pool. The moment you start contracting your calf muscles again, the pump restarts, and fluid moves back where it belongs. Most people notice the heaviness decreasing within 5 to 15 minutes of normal movement. This is your first practical step. But here's where many people miss a second cause that can make the morning problem much worse. The second overlooked cause: what you do the day before. Your legs will feel much heavier in the morning if you spent the previous day with minimal calf muscle activity. Imagine a day where you sat at a desk, sat in a car, sat while eating, and then sat while watching television before bed. Your calf pump has barely worked all day. Then you lie down for sleep. The pump, already inactive, now shuts off completely. You wake with severely pooled fluid and profound heaviness. Compare that to a day where you walked regularly, climbed stairs, and kept moving throughout. Your calf muscles have been pumping all day. Your legs are less likely to have excess fluid sitting around. You sleep. The pump is off, but there is less fluid to pool. You wake feeling notably lighter. This is the hidden cause that affects many people. They focus on the morning itself, stretching, elevating their legs, taking medication, but they miss that the real problem was created the day before through inactivity. One full day of sitting can set up an entire night of fluid pooling. This also explains a pattern that confuses many people. Some mornings your legs feel terrible. Other mornings they feel fine. The difference is usually not what you did in the morning. It is what you did the day before. A day with good activity prevents morning heaviness far more effectively than any morning ritual. Here is your second practical step. During the day, every day, interrupt sitting with movement. Stand and take a few steps every hour. Do not wait until evening. The accumulated inactivity throughout the day is what sets up the problem. Brief movement throughout the day is far more effective than one long walk in the morning. The calf pump needs to work regularly, not occasionally. The third pattern: sleep position and leg elevation. Many people assume that elevating their legs on pillows while sleeping is helpful. The logic seems sound. Gravity will help fluid drain downward instead of pooling. But here is the mechanical reality. When you elevate your legs above your heart, you do reduce some fluid pressure in the legs. However, you also eliminate nearly all calf muscle activity because your calf muscles have less work to do against gravity. This is where intention matters. If you are having temporary swelling from air travel, or a minor injury, or from standing all day at an event, elevating your legs in the evening while awake can help. Gravity assists in moving fluid. But elevating your legs while sleeping all night sets up the worst condition for the calf pump. You are immobilized and elevated at the same time. The better approach is to sleep flat, or with legs only slightly elevated, allowing the calf pump to have at least some efficiency. And upon waking, prioritize movement before you do anything else. This distinction is important because many people have been told that elevation is always beneficial. In some situations it is, but for chronic morning heaviness, elevation during sleep is often counterproductive. The goal is to maintain enough calf muscle tone and activity even while sleeping, not to shut down the pump completely. The fourth pattern: medications and fluid retention. Here is where the picture changes, because some people experience morning leg heaviness not because the pump is failing, but because their body is retaining extra fluid from the start. Certain medications, particularly some blood pressure medications, anti-inflammatory drugs, and steroid medications, can cause the body to retain salt and water. When you are retaining excess fluid overall, your legs will feel heavier in the morning, and the swelling may persist longer through the day even after the pump activates. Similarly, if you ate a high-salt dinner the evening before, your body retained extra fluid overnight. You wake with not only normal pooling from inactivity, but also extra fluid throughout your system. The calf pump can move fluid, but it cannot overcome fluid retention caused by medication or diet. You would need to address the underlying cause. This is why it is important to distinguish between heaviness from inactivity, which improves quickly with movement, and heaviness from fluid retention, which persists even after morning activity. If your morning leg heaviness is severe, involves both legs symmetrically, does not improve with movement, or appeared after starting a new medication, that is worth discussing with your doctor. It could indicate that your body is retaining excess fluid, and that may require a different approach than simple movement and activity. The fifth pattern, one-sided heaviness, and when to seek evaluation. Now we reach an important distinction. Most morning leg heaviness affects both legs more or less equally, and it improves within an hour of normal activity. But if your heaviness is concentrated in one leg, or if one leg is noticeably more swollen than the other, that is a different pattern. One-sided swelling can sometimes indicate a blood clot, a lymphatic obstruction, or localized inflammation. These are not mechanical problems from the calf pump shutting down. These require professional evaluation. Do not assume one-sided swelling is normal. Similarly, if the heaviness comes with skin changes, redness, warmth, hardness, or discoloration, that is not a normal morning pump problem. If the swelling is accompanied by pain, or if the leg feels heavy but looks normal, these are patterns that deserve medical attention. The key distinction: bilateral, symmetric heaviness that improves with movement within 30 to 60 minutes is very often just your calf pump restarting. One-sided heaviness, skin changes, warmth, or heaviness that does not improve with movement deserves evaluation. As you age, your calf muscles naturally lose some mass and strength. Sarcopenia, muscle loss, is a normal part of aging, but it directly affects your calf pump efficiency. A smaller, weaker calf muscle generates less pressure when it contracts. That means it pumps blood less effectively against gravity. Overnight pooling becomes more pronounced. Additionally, as you age, you are statistically more likely to be less active. Arthritis, previous injuries, fatigue, and other factors reduce movement. Less movement means the calf pump works less frequently throughout the day. This is the pattern that makes morning heaviness increasingly common after 50 or 60. The mechanism explains why the problem is not inevitable, though. It is not about age itself. It is about the activity level and muscle function that tend to decline with age. Someone who remains active, who walks regularly, and who maintains calf muscle strength often does not experience severe morning leg heaviness, even well into later life. Here is what to do with this information. First, move immediately upon waking. Stand up, walk, do a few calf raises while your feet are on the ground. Do not wait. Do not lie in bed. The goal is to restart the calf pump within the first few minutes of consciousness. For most people, the heaviness will notably improve within 5 to 20 minutes. Second, assess your activity level throughout the previous day. If morning heaviness is a regular problem, commit to moving every single hour while awake. A short walk, standing work, stairs, anything that causes your calf muscles to contract. The goal is not intense exercise. It is regular, frequent, light muscle activity. Third, reduce salt the evening before if you notice heaviness correlating with salty meals. You may also want to try reducing elevation while sleeping. Sleep flat, not with legs elevated on multiple pillows. Allow your body to maintain normal fluid and pressure balance throughout the night. Fourth, if heaviness is one-sided, if it involves skin changes, if it does not improve with movement, or if it appeared after starting a new medication, write down the pattern and discuss it with your primary care provider. These details will help them determine whether this is mechanical or whether something else is contributing. Fifth, consider adding targeted calf strengthening to your routine if you have the mobility to do so. Even light calf raises, wall pushes, or step-ups several times a week can improve pump efficiency over weeks and months. The stronger your calf muscle, the more effectively it pumps fluid when it does contract. Your legs are telling you something. Morning heaviness is not a disease you must simply accept. It is information about what happened to your body overnight and what happened the day before. Once you understand the mechanism, you can often correct it. The calf muscle pump is not just for walking. It is a circulatory organ in disguise. It works only when you move. It cannot work while you sleep. And when it stops, gravity always wins. Understanding this simple mechanism and respecting it through regular activity changes how you experience your mornings. The goal is not to fear morning heaviness or assume it signals something serious. The goal is to recognize the pattern, understand the cause, take practical action, and know when something genuinely deserves professional attention. Most people who feel heavy legs in the morning have simply allowed their calf pump to work less. The fix is to ask it to work more. Start tomorrow morning differently. Wake up, stand up immediately, walk. Let that pump restart. Within minutes, you will likely feel the difference. That is not coincidence. That is your calf muscles doing exactly what they evolved to do, pushing against gravity and moving fluid where it belongs. The heaviness was not permanent. It was just waiting for you to move.